New research suggests a pregnancy changes women's brain structure in ways that potentially help prepare them for motherhood. Researchers tracked 25 first-time mothers in Europe over the course of 5 years, as well as a group of women who never conceived. They scanned the women's brains both before pregnancy and then again shortly after they gave birth, looking for potential changes in gray matter, the tissue that makes up the central nervous system. Changes occurred in areas of the brain involved in social interactions used for attributing thoughts and feelings to other people. The researchers say this would help mothers become more attached to their baby, among other things. The structural brain changes lasted for at least 2 years, and the researchers found no evidence of women's memory deteriorating. Now, scientists in the Netherlands say sustainable, cheap drug production using solar energy could be possible anywhere with exposure to sunlight. The researchers devised what they call a mini factory that captures sunlight to make a chemical reaction using luminescent solar concentrators. They examine how antenna molecules in leaves capture energy from sunlight and collect it in the reaction centers of the leaf, where solar energy is abundant enough to create photosynthesis. The team says lab tests were impressive and believes there is a vast potential for producing drugs this way without the usual requirement of toxic chemicals or external energy, often provided by fossil fuels. They say the device could be used to make drug compounds in places where solar energy has previously been deemed unthinkable. Dario Cambier is one of the researchers.
Then we had the first device and the test with the reaction, and it turned out that we could accelerate the reaction of order of magnitude. So the reaction came like 2, 3, 4 times faster in solar simulated condition and even in solar light. So that was really surprising for us because, yeah, we knew that the idea would have worked, but we were not expecting such good results in the beginning.
The researchers say the technology could become widespread within 10 years. The findings are published in German weekly peer-reviewed scientific journal, Angewandte Chemie. Now, the prices of medicine in Nigeria are several times higher than in many other countries around the world, according to data from the WHO and the Nigerian government. A group of young computer coders and technologists discovered that medicine prices in Nigeria can be 9 times higher than the global average. Chika Odua reports from Abuja.
In Nigeria, pharmacies are feeling the pinch of the country's economic recession. The cost of medicine at this store has gone up 40% in the past 6 months. Fumi Bola Omotayo says she is worried about her customers.
You can see affordability of drugs is actually life. Your health will not know if you can afford the drugs or not.
She says fewer than 5% of her customers have health insurance to help subsidize the cost. The drugs sold at this store are mostly imported. Public health analysts say less than 30% of medicine available in Nigeria is manufactured locally. Nigeria is facing high inflation and import tariffs have increased.
I can say it's expensive because of the recession we are in Nigeria.
We realize that the price is actually higher than what we normally, what we used to buy.
But even before the economy slumped this year, medicine prices were relatively high in Nigeria. Studies in 2004 and 2010 by the World Health Organization and the Nigerian government revealed the cost of medicinal drugs in Nigeria is several times higher than the global average. The 2004 study found distributor or retailer markups could be 900% of the manufacturer's price. Today, pharmacists and public health analysts know the pharmaceutical system in Nigeria enables huge profit margins.
Everyone's trying to think of their own self-interest, how they can maximize profit, because there isn't a strong regulation from the government. Because you could go sometimes 400-500 times markups.
The high prices inspired a team of technical experts and computer coders to develop an app to help users learn more about the cost of medicine.
So the tool asks people how much they're paying for medicine, compares it with the World Health Organization data showing what an average person is paying everywhere else in the world. And we display what percentage higher Nigerians are paying.
But pharmacist Onyekachi Mbadiwe is concerned that the app may not provide enough information about what goes into pricing.
I can imagine someone tweeting and saying, oh, I bought paracetamol at 500 times the markup at X pharmacy. They're fraudulent, they're doing all kinds of things, and this will go on social media, and we know how powerful social media can be. So I was just thinking there needs to be something to just support the information that is being given to the client.
For now, Temi Adeoye and his team of coders hope their application will bring the cost issue to the attention of policymakers. Chika Odua for VOA News, Abuja.